What I wanted and what we wanted when we decide and we were building this workshop is to understand a little bit, the policy work and the relevance for the patient advocacy groups in the bladder cancer arena. So explore best practice. We start in the morning, but today we will continue, looking at best practice and good examples from other disease areas too, who have been successful and could be inspiring for you, and create actionable steps for policy work and plans on your own. That's the most complicated thing, especially when you have 1.5 hours to do, and now we have 45 minutes left. I will run on this just to give you a little, background about the Latin American Patient Academy. We have been working since 2006, but it's officially established in the US in 2018. So during the pandemic, we did a lot virtually, but we organized kind of capacity building meetings for patient advocacy groups in the region. We do a lot in HTA. We partner with the governments and the HTA agencies to build, the support for them for have this patient involvement in HTA. So we have been working for the guideline in Colombia in partnership with the IETS, which is the Institute of Health Technology Assessment in Colombia. And the patients build that as a best practice. I want to share with you this too. So we did that in Colombia. We are advising the governments like Ecuador, Brazil, and Dominican Republic too. So we build expert groups in the countries, and what we do is try to have these experts in HTA who can participate and advise the governments and be on the table and not at the table. So what is policy work? So I just wanted to share with you what's happening 1 week ago. It was the UNGA, so the United Nations General Assembly. And why I put this, because I wanted to start from the global through, the local or the country policy work. But I think it's very important to see what is policy work, because we influence, decisions from the governments, but we start sometimes at the very, very, huge level to go in each country. And this is more or less the successful cases when we do policy work in itself. Why? Because we use a lot these platforms, so the UN start having this kind of memorandum of understanding. Sometimes we do expert groups who start with this. We ensure that, the topic is on the agenda, and like this, the compromise from the countries who are members of the UN can start thinking about the problem and then go and start doing. Sometimes it's very ideally, but in the case of NCDs, it was one of the big things that happened in 2011. When it was a high-level meeting, like the one who happened the past week, and we start working. I was there by accident because I was invited to the WHO General Assembly, and then during that meeting, a little group, which is now the NCD Alliance, start talking about a UN resolution about NCDs. And I was passing through, taking a coffee. And then I start asking a request for more information. A Peruvian coming from very far away, working in Peru, doesn't mean anything for them, right? So I was like, oh, I am interested. What is this about? And then I was invited to the little committee, and we start working on this. And I spoke on behalf of patients during the UN to get this resolution. It was so interesting, so funny, but it was also, as Michelle said, asking for it. Asking and meeting people, and don't be stressed about what they will tell about me or say, So I think it's very possible for any of us to achieve big things or stay or be in a good moment, in the right place, to do something really relevant. So I just wanted to put this, on the plate, just to let you know that if we think and we saw the UN as a very far away, institution, no. And sometimes it worked a lot because since that we have been advocating for cancer plans in the countries to have more medicines for the plans that we have. So it was relevant for the countries that really are involved. It's not easy, but the patient advocacy groups work it out. And now there is many more alliances. The UICC is working on that. The NCD Alliance is working on that. The America's Heart Foundation is working on that, and many more other organizations. And also Oncoguía is working in Brazil. I think the Asociación Mexicana for the Lucha contra el Cáncer is doing too. Campaigning for cancer, I saw some things and some meetings, after this resolution. So you see, it's super relevant, and this is where we start doing the policy. So just wanted to explain a little bit also and put some very important work that the Alliance and the coalition is doing. Because we were speaking with Alex, and I love to map. I love to map. I love to Google things. This is my fun. I love to be, involved, and I love to know people, even online. So I like to Google people just because it's the way that you map also the other person and the audience that you have. Prepare whatever you want to do. And when you do policy work, you have to map people, and sometimes the only way that you map the person, it's online. So it is important to Google yourself to see what you found. Because if you are a patient advocate, you have to Google yourself to see if you like what it's online, or you can add. And as Michelle said, Google can give you, the opportunity to highlight your profile. And if you highlight your profile in the way that you want, you could be more findable for the sponsors, the politicians, the patients, the organizations that could be interested. And when we do policy work, we have to be very careful about who we are online and who we are also in person. So it's very important as a tip. And I was, looking on this very beautiful white paper webinar that you did. And this is the beginning of something very important. If you start doing advocacy or policy help, you have to build evidence. The white paper starts on this. If you translate that, then patient groups, members of the coalition, non-members of the coalition will start, working with this little evidence, because it's little right now, but it will grow, and you will have more and more, demand to work with partners and to advocate in a good way. So I wanted just to put this on, as a good example, because it's very important to, when we do policy, we have to have it. We have to talk with numbers. We have to have evidence very clear, very explaining and real. Not only say, in my country it's 30%. Who is saying that? Huh? Who? Where I found the evidence? And if I produce, in France, they teach me a lot of the scientific rigor that you have to have when you produce evidence. So when we do anything, when we do a paper, when we do a pamphlet, anything, you have to have the citation, the found, where did you found this, the links, and everything to explain. Because when you go to advocate with a policymaker or any people, and you have a meeting, you have to have all of this information just to provide also. So one of the things that it's important when you have direct engagement with the government also, it's be real and have good numbers and have good evidence, not only say, I am speaking and I have a group on my chat and I'm doing that. Yeah, you have a group and you can produce evidence from this chat saying this is like 5% of the population who has bladder cancer, who is speaking about this. who's doing that. So you have to be very creative and flexible to generate that kind of evidence who can help you to advocate better. And also, if you have these kind of white papers, you can have, you know, many more materials to produce after this beautiful, beautiful document that I need. So, and also, when you do policy work, you have to organize kind of sessions that involve many other people who are not only in the bladder cancer arena. Why? Because if you want to spread, if you want to raise awareness, if you want to put the interest on that topic, you have to invite people who will be interested and also people who won't be interested that could be potential champions for you. So this is sometimes that we don't think about. When we are involved on one thing, we don't see the rest. But you have to think about, you know, more and more outside of the box as you know, as something that you have to um, 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 help the other patients also and the people who will need more information related to that. When you do policy work also, you have to be clear. Why? Because if you're not clear and you talk with abbreviations that we were speaking yesterday, when you think that the other understand the abbreviations and they don't know anything about that, sometimes, you know, it gets boring for the other person. So you lost interest, you know, and the person say, okay, nice, smiling, they close the door and they never remember or they won't be able to see you again because you are so complicated and so difficult to understand. So when you start doing this kind of work, please don't speak with little abbreviations. Even because now we are a global world, and also when you don't have the language, you know, on your side, it's complicated to read this. And I wanted just to share with you some examples of things that I Googled, you know, and what I saw online about yoga. And you're doing excellent, awesome work, you know, producing information, putting online many, many materials. But it was complicated to me to pop up on this. So I think we have to work more and more if we want to do policy work, more and more to spread that because it's not only for the community that's bladder cancer, or it's related to cancer, or it's related to the clinical side. So if you want to be more, you know, known by the community, I think this has to be in other places, not only in the hospitals, not only, you know, and, you know, you can have more ideas to start the collaboration with other actors who can, you know, spread your information. And sometimes online works well if you have joint ventures or, you know, associations with other partners who are not only on the health arena. And that helps a lot when you when you when you work on policy. So I cannot read. I'm very I'm put this as a support, but it's also so. um, when you produce also, you know, support groups. So when you start this support group, I saw many groups in many different disease areas because I work with rare diseases, I work with cancer, I work with infectious diseases. So it's you know, very diverse. I'm seeing a lot of chats, a lot of Facebook groups, but what I didn't see, and I'm looking less and less, is one-on-one peer, you know, groups that could be very useful. Have a good friend from your disease to exchange and support each other. So this is working very well for the rare disease community. I understand that it's, you know, less people involved, but it could be a good idea for you as a good example to, you know, to do support and help them. But and also it helps also for the awareness, you know, and start kind of spreading the word, doing more and more, and preparing your speech. How many of you have prepared for, you know, anyone who can have, you know, who can go with you and say, oh, I'm working on, I don't know, on Ministry of Health, and I'm the advisor of the. Are you prepared for that? And when you do policy work, you have to have your speech prepared, something a kind of template that you have to say, you know what you want, you are advocating for something, and don't say only, oh, I will send you information online, or you have to have this kind of, that's why I was doing this exercise, to introduce yourself, have a fun fact, and have 30 seconds of time that you impress the other. Because when you do policy work, you have to impress the other, and the other has to, oh, I like this lady, it was funny, but she told me something very interesting about that, and I want to help her, That's the thing that you have to find or look at when you introduce yourself and your organization. So be prepared for that. When you do policy work, you have to be prepared for that. And you have always plan, in advance if you have a meeting or if you see something, and have a speech special for this person. That's why I am very Google person, because I need to know who is the other one, and I need to know just, because if I speak with them, I have to be empathetic with the other person, and also know a little bit. It shows interest in the other. And when you do policy with other humans too. And that's something that we have to think about. The other person has their own problems. And when we go for, to advocate for a cause, we have to understand that the other person has also another agenda, different other things waiting in, in the desk. So it's super complicated to make sure that this person will be on the agenda with you or follow you. That is why you have to insist all the time, because you can forget. You can say yes, but if you think that it's a yes and you don't follow up, also you will miss the opportunity to happen with the outcome. And for that, I prepared something that I. Yeah, per table, I think, because I just bring two, and I think Theodore will. It's okay, because I have many things. Thank you, Theo. And I think it's very important to have this rapid action review, which is very useful tool that USA has, for the officers after the meetings. Any meeting that you do, any policy meeting that you do, you have to have this kind of tool to see, and right after the meeting, very immediately after the meeting, who was in the meeting, the background of the person, what worked on your speech, what didn't work when you were presenting. Like this, you can learn also from a mistake that you made, or something that was not told, or, a problem or a policy that is not working because of something, and what you can do differently for the next. That make you, this approach to see and to criticize yourself, but build something from the mistakes. And then you have to do also for the action plan. What are you going to do? Because we will work on this, and you have to have the habit after the meetings to have that. Now we have artificial intelligence who can help us too. Many people didn't like it, but it's a good tool if you know how to use it, because now you can put a lot of information and request, make me a report, put me some, and it could help you also to follow up with the people who you are meeting, or you can send that to this person saying, okay, that was the meeting, the key, takeaways, the to-do list that I put, and thank you very much. And you put something very interesting and very professional. When you do policy work, you have to have this habit, and then this person will say, oh, this organization is serious, because it's sending a report, it's taking notes, it's doing something, and it's asking for, an outcome. So it's, you know, it's kind of tools that you can use. It's already, you know, it already exists as a template, so you can use a part, you can use all of the, you know, all of the topics, and it will be very important for you as a habit, because you have to look your organizations as Dr. Lydia's raising her hand as an enterprise too.
19, thank you. It says manageable interest in the template. What is a manageable interest?
So, you know, you can interpret it as a, you know, as a tool for you to have more information, you know, and manage what you talk about. It's just, you know, kind of a template to inspire you to do something. I'm not saying that you have to use that. It's an example. It's a very good practice that USA use for the meeting. I was training with this, and I promise you, I do that all the time when I have meetings, and I write not on the template now. I remember I put my to-do, my didn't work, my things, and the manageable interest for me, you know, that I can manage and I can do something with the other and find an outcome after that. So it's kind of you can, you know, you can see that as a resource. I wanted to share with you because it's very useful, and it's been very useful for the community that I work. So more examples that I saw, and I wanted to share with you that, you know, little groups are also doing things. And I put this example of the GPAC, which is a group like the one that Mayra have, you know, many other cancers, but one campaign. And they write, I put this example, why? Because I like it, you know, the note that they put, kind of press release that they did. And I think it's important also when you raise awareness, you have to have this press release who made a good information about the topic with data, with, you know, support, and also someone who can, you know, be in charge of this campaign to find and to have as an address to answer or looking for if you want more information. This is something that I found interesting too, because I was working in Belize for the last 9 months. I was coordinating a project there. And, you know, the Belizean Cancer Society started doing something related to bladder cancer. I was just, you know, surprised, because a little tiny country like this doing a campaign, and they did that. So I think you can find this organization as, you know, one of the potential members of the coalition. But what I found with what's interesting, it was that the physicians did that, you know, this little Instagram video. So, and they were advocating why? Because we were building the cancer plan in Belize. So we were voting and approving that, and it just was launched for that moment. But, you know, it's bladder cancer. So we were working on cervical cancer, but someone was interested on that. And I'm very curious for this, but also I put this example because there is moments, there's windows of opportunities that you can find, you know, when you do policy work. Because as I am saying, Belize was doing the cancer plan. So the interest is on the topic. The ones that are working on this will have, you know, more outcomes with the policy, and probably will be, you know, approved many guidelines, many more, you know, requirements for them, for the disease. So it's very important to see and find the good moment, the good timing when you do policy work. And also, sorry, I saw also this Facebook group. And I wanted to, you know, I wanted to share with you, when you do policy, it's not only talk with the legislators, with, you know, the ministries of health, the people who are involved in the government. It's also talk with the public, the constituent, that has, this power to be with you when you need this, this like people behind you. So it's very important to have this community, and you have thousands of people in the community. Like I think it was 6,000. So it's interesting to see, and then if you do an advocacy, like a campaign or something, you have that, that you have at least 6,000 people who will, follow you and put at least a like on your group, This is important to have this community on your side who will be part of your group when you do advocacy. So the challenges, and this I will open the microphone a little bit because I think we need to talk about that. We always say that there is a lack of resources, there is a lot of bureaucracy too. When we do policy work, it's always a problem because we have resistance to change. If we want to change something, no one wants to change that. So, we have to have this empathy with the other, start, the conversation and say, look, I realize that this is not working, but I put something on your table as a suggestion, and I'm advising you that it will work. So we never criticize something without a solution. And if we want to do something different, we have to engage different stakeholders. And for that, I wanted to open the microphone table by table because won't let me stop there. Like, I don't have anything to say, but you have a lot to say because the challenges are huge. And I would love to hear from you, what challenges do you face or anticipate in your country? Because we have a very diverse group. It will be important to see. Laurie, she's raising her hand. So we can start with her, and then I would love to hear more and more about the challenges, because the next slide will have some kind of advice for this. Go ahead.
So one of the challenges we face is a geographic challenge. In France, all the policy things happen in Paris, and none of our board members are based in Paris. I'm in the south, somebody is in Tours, and somebody else is near in the center. So there's been a few opportunities for us to attend, like a parliamentary breakfast and be able to talk to policymakers. And it was like the day before, you have to be in Paris at 9 in the morning for this policy breakfast. And we just don't have the organizational flexibility to do that. And I don't know how to overcome that, because sometimes, it's just also last minute, and we're not ready for that. We don't have the people in the right place able to attend these in-person meetings, which are really important. But maybe somebody here wants to finance my apartment in Paris.
No, it's happening also with the groups in Brazil, the same challenge, because the parliament is in Brasilia. Most of the groups are based in Rio de Janeiro or Sao Paulo, so they are not, for those kind of, but we will talk about that.
We have the same issue. Geographic is huge, coast to coast to coast. And also the additional challenge is it depends on where you live in Canada in terms of the support you get. So if you were diagnosed with bladder cancer in Canada, your best province to live in is British Columbia. They cover everything, any stoma support, any extra equipment you need. But in Ontario, where I am, we cover nothing. So that's consistently inconsistent, because there's two, as I mentioned yesterday, two levels of healthcare, the federal level and the provincial level. So there's no consistency.
Yeah, thank you, Michelle, for that. I think.
So when it comes to policy advocacy in South Africa on the challenges, I think the way that our government is structured, so it's together, but it's apart. In other words, we have different levels of government in health. So we have a national department of health, and then we have like state departments of health, And then underneath that, we have other departments. And up until now, it was always the same political party. Now it's different political parties. So it's getting to understand and have to speak to each one of those because each one of them are different. So it's understanding who everyone is, keeping track of them because they come and go. And then also looking at political will. In South Africa, sometimes we are drowned out by different diseases. So it's not seen as a priority. Then also, I think that we've also, we have financial issues in our economy. So we're always being told that that's the reason why we're not. So when we're coming to them, we're having to come with sophisticated solutions. In the beginning, when you start, it shouldn't be, but a lot of the time we fall into the trap of just complaining and not giving a solution. And after the last 16 years, the solutions that I'm having to present to government are becoming more and more sophisticated. And that's a learning curve for us, is to understand pharmacoeconomics, looking at alternate reimbursements, looking at, we're now having a conversation on NHI. So now we're looking at constitutional law and how that fits in. So it's all this stuff that we have to understand when it comes to policy. Because if I'm advocating a solution, I have to know what the impact of the solution is that I'm following. And that can be a lot of it. In the beginning, what we used to do was, I'm sorry, I'm taking a long time, but in the beginning, what we used to do is we used to look at bigger organizations and then do our policy. And in fact, we met, we're not going to say how many years ago, when we were working with the American Cancer Society and Live Strong and all that, just on understanding that we were advocating for national cancer control plans. Now, that was something I didn't know about, but I knew that if the American Cancer Society and so on had done it, then maybe that's me lending my voice to that. So a lot of the time in the beginning, what we did was, we lent our voice to other things, and that was making it easier. It was also how we managed to get our reach further because we were working with other groups. But now I feel like the pressure's on us because we're that person that has to provide the solution. And that solution is sometimes very technical.
Any other intervention related to challenge, Dr. Lydia?
Thank you. Yes, so I know that in a lot of our countries, there's actually more than one country as well. So like in Spain, for example, Spain isn't just Spain and Canada is not just Canada. And in the same way, the United Kingdom, we don't even just have one parliament. We've got one parliament in London that's supposed to be for the entire UK, but then we also have a parliament in Wales, we have a parliament in Scotland, and then we have a legislative assembly in Northern Ireland as well. And so we need, and the health system works differently in all of those places. So sometimes it can be easy for us just to think about England, which is the largest part of the United Kingdom, but with very few resources, it's also challenging for us to try and engage and do policy in the smaller regions that have different government systems.
So it's very interesting to hear those challenges who are, and I forgot to put I have a slide that shows you the differences in the world. Like you have the equator, and down, except Australia has many other challenges too, and then in the north you have other situations that, be comparables. So the geographic challenge, Eduardo, the geographic challenge will be, an issue for everybody because it's very complicated to arrive on time, whatever. So go ahead.
Bien, para nosotros es también un gran reto. Tenemos dificultades con el acceso de medicamentos. De hecho, de cáncer de vejiga, tengo 6 pacientes en lista de espera desde el 2023 algunos. Y estas moléculas, aunque son muy buenas, hay muy buenos resultados, pero son costosas para los países en vía de desarrollo. Y es lo que nos afecta en toda la región de Latinoamérica.
That, Alex. Oh, yeah? The question for him is that, the challenge is access to medicines because in his organization, he has 6 patients with bladder cancer, and many of them are waiting their, advanced medicines or target medicines since 2023. So this is also something that could be, helped by a good policy. But we have to also build awareness and information and data to show, as he present, since 2023, a patient waiting for a medicine, it's a big problem. But as I was saying, this map of the world that I have, and I show always saying, there is also inequities on the world, not only on the countries. There is many, advanced information, advanced treatments, advanced many things in the north that don't arrive on time or arrive very, very late in the south. And this is something that we have to work a lot because, we have a study, like we launched this study. It was not me, it was an organization named Pharma, which is like the pharma for Latin America, and they did something related to access to innovation, comparing, the 220 different new therapies, for cancer and rare diseases, and the gap is huge. We have to wait at least for the, for the most easy access, 18 months to get access or to register the therapy. But to get real access, it's at least 3 years. So it's super complicated. And, we have to think about how we can work together, to get the innovation at the same time everywhere. Because the new drugs are being launched in the north, but to get the information, to get access, to get, it's super complicated. And sometimes patients don't have the opportunity and they don't.
So I just had, there's a comment from online from one of our members in Malawi. There's just a few comments on the challenges that they face. So challenges in, there's 4 in total. So I'll read this out. Engaging policyholders takes long due to protocols involved. And we know that policymaking takes years. You will never have an immediate win. This is a painful and long process where patience is necessary. That was my comment. Number 2, you're always put on hold, especially when there are no immediate personal gain for policyholders. And there is that link as well that you mentioned, political will and political interest. There has to be something in it for them as well to really make that a priority. Number 3, issues of resources is a big challenge. In policy advocacy, need a big chunk of money or time, resource to support it, right? And to be persistent. 4, political will in both key stakeholders and those in government department, especially those in decision-making seats and as administrator. So again, political will aspect. And then he mentioned also technical capacity of being able to contribute. But that's why we have this session here to trying to start building up our knowledge in this space.
So, we hear that the challenges are more or less similar because we said the geographic one was one issue. The other one was too many administrations and too centralized things in many countries. It's the same, if we talk about Australia, then we can talk about US because US has also 51 different states, different regulations, different legislations, different access, different, systems of insurance too. So this is a challenge, but the guidelines for treatment could be kind of harmonized, step ahead to do, and then try to improve this or have the same access everywhere, like worldwide. And I think this could be one of the things that I can look as a policy for you for the next work. Then you talk about the structure of the government. I have to say, the structure of the government sometimes in your countries are okay. In countries like, Ecuador or Peru or, Paraguay or just Brazil are so complex because are so fragmented systems that you can meet the ministry and it's not him who decide. Or you can meet the first lady and the first lady decide to do a law to find resources for rare diseases. It happened to me in Panama. So it was the first lady who said, oh, that's a very, very, very important topic. So we have to do something. And we were allowed the budget from the presidency to pay the rare disease community access for treatments. You're like this, okay, it will be feasible. I think this is a good start, but it's impossible. And we're still working on this, but it's important and interesting as a good example to see, that the challenges are everywhere, and it's us who has to be very flexible. I have 5 minutes more. Very flexible and collaborate with other organizations, target specific regulations that we want, and also build long-term relationships. You don't meet the people and say, oh, this one, you have to build this relation. Sometimes in our countries, and I'm talking for South America, Latin America, where, the ministers of health and the administrators in the governments stay for 1 month, 2 months, 3 months, 6 months. It's very complicated to build this kind of long relationship. But you, in the other side, sometimes have more than 2 years to have the time to build this relationship, this trust with the other person to do big changes. So I wanted just to share this also as a good, examples that I saw, that you have tools in your own organizations. Campaigning for Cancer has this patient advising academy or incubator. I saw that it's having, online courses for advocacy. So you can see specifically for cancer, this kind of tools. You have also in the UK different, information and resources. I like it, the website from Canvas in Spain that, it's a consortium of different other stakeholders, and this could be also a good model to see because there's researchers inside, there's other people, not only patients, who can help and be part of your change. Oh, what happened? Well, it goes. No, it goes. Sorry, I didn't do that. I'm sorry, but it's okay. No. So I just, this last slide, I'm not doing anything. Touching. So just, going through this case study, the policy success in healthcare. Look at this, resolution that we did in 2012. Inspire you by this resolution. This resolution is being reviewed every 5 years from now. No, so you can see that as an opportunity also to talk about bladder cancer. It's not only it's related to NCDs, but it goes through this. And when you work on policy, you can also use the resolution as a base of your talk. Like the resolution in 2011 talk about this compromise, this thing. So we have to do something related to that. It could be a very useful tool. And I wanted to share with you, the political activism, and also share with you that policy and policy work take time. It's super complicated. You have to have a lot of patience. If you see the movement for breast cancer, it started in 1913, more than 100 years ago, but it's a lot what they did, in the country. That is just an example for the US. It's a lot that they did, and now they have access. They have access to, precision oncology, precision medicine, many things, and we are advancing. But just I wanted to share that as a positive example and say, okay, it takes time, it takes a long time, but it's not impossible. So you have to build that, and you are starting the work and building the movement. And I think in 5 years more, you will have many things, because also innovation is coming, and you can have many more hope for this topic. And I think I will close with this one, because it's very important to work, on the analysis, collaboration, advocacy, and sustainability of the work that we do. And I put some steps in each of the phases that we have, because the phase one, when we analyze the problem, when we start doing the policy, we have to start working on the landscape research first of all. Then we have to set up the objectives. We have to look the decision-making process, and and also all the time when you do that, you have to be very careful with the outcome that you want for each step. When you analyze something, what will be the outcome? What do you want? What do you want to achieve when you start doing, the process? And when you collaborate, what do you want with this collaboration? When you advocate, what do you want from this advocacy? So be clear on the things that you are doing when you do policy work, and use my rapid after action review for each of the steps, because it will help you a lot, when you start a process, and when you start a policy work, you have to have this sustainability also to follow up and to set dates to achieve what you want. When you do policy, it's not only, one day, or it will take time, as I'm saying. No, it's one day, but from here through the next year, I want to achieve at least, access to diagnosis, to early timely diagnosis. I want to have more information related to bladder cancer online. I want to have, things that you can measure, you can, and also you can share and make you proud of your work. When you do this, you have to set it up, a follow-up of your work too, and see what did you achieve, and be proud of this. Otherwise, you feel always like frustrated. I'm not arriving anywhere. I'm not doing anything, and I won't arrive. So I put this example as, kind of an idea for the coalition to work on this, and, set a little, graphic related to access, and the power to bladder cancer elevator, the patient-centered outcomes, related to research, or something like this, that you can work as a group and change policies and advocate for new policies for, access to expert groups and things like this that could be inspired for you, like the steps that you can do. And I will just close saying, as the NCD Alliance Toolkit, because there is a resource in the PowerPoint, you can find the toolkit. Advocacy is an art, but also a science. An art because you have to be you have to be very creative, very flexible, but also very realistic, and have a lot of evidence to do a good advocacy. This is the resources that I wanted to share with you. So you can have this guide, the advocacy guide from the NCD Alliance in different languages, and also the link to this. And thank you.